I get a lot of questions about what kind of testing to do to help discover how to treat whatever condition a patient has. On today's episode of Ask Dr. Gil, I want to go through the different types of tests that are available and find out what might be useful for treating mental emotional illnesses as well as some physical illnesses. So stay tuned. Hello and welcome to Ask Dr. Gil. I'm Gil Winkleman, your host, and I am covering today a very broad topic. And in fact, we may not be able to cover everything. In fact, I know we won't because I try and keep these podcasts to a certain time frame. But I do want to cover a general overview of the different types of tests that are available. And part of the reason that I want to talk about this is I'm going to do a podcast up here soon on the organic acids test, which is a urine test. And I know I'm going to get a ton of questions about why doing that test versus another. And I think understanding the broad scope of testing is super important because without sort of that overview, it becomes more challenging to describe the benefits of the organic acid test. So let's get started and jump in, since we're together, and talk about different types of testing. So, let's start with stuff that is, not very invasive. Obviously, there's X-rays and bone scans and CAT scans, PET scans. There's one at the Aiming Clinic called a SPECT scan, which is a scan of the brain. And I want to kind of put those to the side because those are usually for specific things that are, we're looking for something specific, a broken bone, for example. Obviously, you can do a blood test to see some markers, but you're going to want to look at the X-ray to understand how to set that. And for most of the things that I'm treating, there's not something organically, physically off, although that does happen. And many times that is the underlying issue. I've had numerous patients, for example, who've had a SPECT scan, SPECT, done at the Aiming Clinic. I don't know if anyone else does the SPECT scan, but I can tell you that is an incredibly powerful tool for many people to understand sort of, what's going on in the person's brain and how things are or are not connecting. And similarly, SPECT scan, there's also an MRI kind of adjunct called a neuroquant that is incredibly useful for all kinds of mental emotional illnesses, including Alzheimer's and or other dementias. The neuroquant measures brain volume. So if there's a problem with going on in your brain that has to do with the brain shrinking, the neuroquant can quantify that as well as understand the progress. And by the way, if that happens, it is reversible with natural approaches. And I think that don't just give up hope if that's the situation, because we have seen cases of patients who are reversing it, and we're starting to see more of those. But I don't want to get into the details of those. I want to talk about blood, urine, hair mostly today, and sort of the options available. And blood tests are kind of the bread and butter that I do as far as the mental health, mostly because I focus on the Walsh protocol a lot. And the reason I do that is that because I'm getting, 75 to 85, probably 75 to 80% of my patients fall under that category, that we're going to find that with the blood tests as well as the pyroluria test. And I'll get to that in a minute. And I talked about the pyroluria in the last podcast, and I've talked about it in other podcasts. And, I think it's a very, very useful test for some people. I'm finding that there are times where I'm 99% sure the person has pyroluria and it comes back negative. And there are different reasons for that that can show up. And so typically I like to run it with the blood tests. I do like to look at plasma zinc. And the reason is if that is low, the pyral test will also be artificially low. And it has to do with how the pyrals are found in the urine, and it needs a zinc conjugate for that to happen. So sometimes if you've run, and I've had patients call me, they said, I did a pyroluria test. I thought I had pyroluria, but it came back negative. And it turned out that I said, no, I think you have it. Let's treat it. And they got better. And it turned out that their zinc was super low. So that's why we do the blood test. That's part of the reason why we do the blood test. So for the blood test, obviously I sometimes run a CBC, a complete blood count. I run a chemistry panel. I want to see what's happening in the liver with the liver enzymes. I want to see how people are managing their blood sugars. And the reason I do this is sometimes you find something else that's going on that has seemingly nothing to do with the presentation, but that is actually the underlying cause. And I'll give an example of a patient I had recently who came in. She's been anxious for a long time. And we did, the testing on this. And, the anxiety has become more and more debilitating. She has had trouble sleeping. She has had trouble focusing as a result. And I was thinking, okay, maybe she has low zinc. And that's what's going on with her. So we did that. And she was low zinc, but her eosinophils were really, really high. Eosinophils are a type of white blood cells. And they can go up for a number of reasons, but the reason it went up in her is that she had parasites. And that was basically why she was having the issue. So once we treated that, her anxiety dropped, her sleep improved, her focus then improved because she was sleeping. And so that's part of the reason why I think it's important to look at that stuff. And I probably only see that in maybe, 1 to 2% of the people where something outside of the general scope shows up in a blood test. So that's the purpose of that. And of course, with the Walsh, and I've talked a lot about this, we look at whole blood histamine, we look at copper and zinc, and ceruloplasmin. The whole blood histamine is not a perfect test. And if people are on antihistaminic medications, and there's a lot of medications that are antihistaminic, even though that's not their main mechanism of action, but they have enough of an effect that they can lower histamine and skew that test. So that's something that's why it's important to have a provider who really understands that test, by the way. So the whole blood histamine can give you a sense of methylation. So a high histamine will give you usually points to an undermethylated person, and a low histamine usually points to an overmethylated person. But sometimes people have high histamine for other reasons. And so it's important to kind of recognize that is the case. And, that test can be very useful for patients. And I think that I've talked about the plasma methylation test as well. So if if someone is suspicious of undermethylation, the plasma methylation test can tell us whether that is in fact true and why that's true, because it looks at each step in the cycle of the methylation. So I'm going to take a break, and when I come back, we're going to talk about more of these tests, and I'm going to talk about the oat test a little bit. So stay tuned. Hello and welcome back to Ask Dr. Gil. I'm Gil Winkelman, naturopathic physician. I wanted just to remind people that if you have a question or a topic you want covered on a podcast, please feel free to send an email to info, I-N-F-O, at AskDrGil.com. That's AskDrGil.com. And ideally, it's something that's broad. You know, I get a lot of questions that have to do with, I have X, Y, and Z going on. And that can be helpful, but if you can generalize it as well, that would be great, because I am always looking for topics to help, and cover on my program. And, if you have the question, someone else may as well. So, okay, well, let's get back to testing. And I've talked a little bit about the blood. By the way, I have other podcasts about the copper, the zinc, and the blood testing. But I wanted, to just let you know kind of this overview. So that's kind of the Walsh perspective. And, that's the core of the Walsh perspective, I should say. And, I will do other testing at other times for different things. Obviously, in the case of digestive issues, I will do stool testing. And, one of the things I do want to note real quick is I'm not a firm believer in an IgE, IgG food sensitivity test. And there really is not a great test for food sensitivities, just so you know. I've had colleagues who've sent split samples in and have gotten different results. So in other words, they drew their own blood, they sent it in as two different labels, and they got very different results from the test. And even with that, some of them will still use that test. I haven't found it to be as useful as I would like. Where it is useful is I do have patients who really do need to cut something out and, say gluten, and they won't do it unless I do the test and they see it on the paper. And that's the time where I will sometimes run that test, or, a parent will ask me to do that for that reason. But as a medical test, it's not my favorite, and I'd rather just do an elimination diet. But having said that, there probably will be a blood test that will help develop it. And there is a stool test that can sometimes help us see if there are food sensitivities. So the stool test, there's a few different companies that run basically this test. And the test looks at the IgA, which is what you find in the digestive tract. It's an antibody that sometimes when you actually have food sensitivities, you see high levels of that in the digestive tract. And so I think for testing purposes, that is a better test, in my opinion, than the IgG or the IgE. The other advantage of the stool test is that a good stool test will also look for other markers of digestive function. So you might be able to see, chymotrypsin or alpha chymotrypsin or lipase. These are all digestive enzymes, and you can also potentially diagnose an irritable bowel disease from this. In fact, there's several tests that are add-on tests that are very useful for this and don't require scoping. So that can be very nice. Scoping meaning like a colonoscopy or an endoscopy. The other advantage of the stool test is sometimes you can find evidence of either bacterial overgrowth or a yeast issue or some kind of parasite. And the challenge is that you don't always see that in every sample. In other words, for example, there's an O&P, an ovum and parasite test that you might have had done if you have digestive issues at your GP or your gastroenterologist, which is a very simple test. And and they'll even say, you may have a parasite, but we may not see him in this particular sample. And it's sort of a hit and miss, if you will, as far as finding that, as far as finding a particular parasite or yeast or whatever it is that you're looking for. And sometimes, the organism hangs on inside the digestive tract and doesn't actually release anything into the stool. So that's why that test it's a great test, but sometimes, a physician might do the test. It'll come back negative for, the parasite or organism, but they're still going to be suspicious of it. And that's where the organic acid tests can be really helpful because, and again, there's different companies that run this. There's different types of organic acid tests. And I'm going to talk about the organic acid test in more detail in a podcast because I think it does deserve its own podcast. But there are markers in that test that show metabolites that show up in the urine if you have certain species in your system that you shouldn't have. And generally, we have all of them. We're going to have yeast, we're going to have molds, we're going to have different strains of bacteria, we're going to have different strains of potentially Clostridia, which is a spore-forming bacteria. Those are all found in most of the O tests that I've run. But, they're below a threshold that would be considered a problem. And so the O test can look at it in the urine and compare it to the concentration of the urine too, because depending on how concentrated your urine sample is, that those numbers will fluctuate, and the availability of those markers. If you have really concentrated urine, the reference range might shift. Is kind of what I'm saying about this. So, for example, I've had some where arabinose, which is a yeast marker, I've had some where it's been less than 50. Anything less than 50 is normal. I've had some where anything less than 20 is normal. And it just depends on the sample. So that's the nice thing about that particular test. And you don't actually have to find the yeast anywhere in the body. You just need to find the metabolite that the body creates as a result of the yeast, and that shows up in the urine. So it definitely has some advantages. The disadvantage of that test, of course, is you don't necessarily know the specific species, for example, and we don't always test for every species. And I'll talk more about the O test in a different podcast because I think it does deserve its own podcast. Finally, there's the hair testing, and I know I think I covered that in a podcast previously, but I wanted to just mention it here because I think it is an important test. It can be very useful to find general health issues, but it can also be super useful to find heavy metals. And I had a patient come in recently. He actually flew in from another country to come see me, and he had suddenly just kind of gone insane, and it was very, very sudden, according to his dad. And, the meds had helped, and I was like looking at his intake, and I thought, okay, we're going to need to run some tests. I figured, well, you're probably undermethylated, but you might have a mercury issue. So we basically ran everything. I mean, they'd flown this far, so we ran everything, and it turned out he very much was undermethylated, but it was the most bizarre plasma methylation panel I'd ever seen. And when we ran the hair test, it all kind of made sense because that came back, and he had super high levels of mercury in his hair. And we don't always see. You can, with a hair test, sometimes the mercury or other heavy metals can be inferred from other markers in the hair test. So you might not see it in the particular metal in the hair, but other markers which are normal, normal hair constituents might be off, and that can also indicate, a heavy metal issue. But in this particular case, it was very clear he had mercury toxicity, and mercury will block the the methylation cycle, and that was exactly what we were seeing in the plasma methylation test. And we've been working on bringing his mercury levels down, and he's actually getting better. So it's really quite amazing. So that's all I have today. I'm glad that we covered sort of this broad scope of testing. And if you have questions about this, please let me know. If you're a potential patient and have questions about what kind of tests I do, I hope this answered it. Typically I'm going to run the Walsh. I'm going to run, whole blood histamine, serum copper, plasma zinc, ceruloplasmin, probably vitamin D and homocysteine, and potentially the pyroluria test as well. And, if you haven't run the CBC and the chem panel and stuff, we may run that. And then we might add on other tests as necessary, depending on, what shows up or how you respond to treatment. I don't run everything all at once. It's just too expensive for most patients. Much of this is out of pocket. So, I kind of pick and choose what I want to test. But I usually start with the Walsh core because so many people get benefit from that. And there's an occasional patient that has run it and we haven't found anything, and so then we'll kind of look elsewhere. Or occasionally I get someone who's run it, treated, but it hasn't done anything, and so that's when we dig deeper. And I'll talk more about the specific OAT test and why that's helpful in the next podcast. If you have any questions, again, please feel free to email me at info at AskDrGil.com. That's AskDrGil.com. And if you like this, please share it. Please let people know about the podcast and my website, www.AskDrGil.com. And I always appreciate, questions and feedback. Thanks so much for joining me. I look forward to talking to you next time. Take care.